COVID-19 was a novel viral illness which was first described in China in 2019. The first patient with COVID-19 was reported in the UK in late January 2020. We had our first patient at Bradford Teaching Hospitals in mid-March 2020. Early on in the pandemic, we knew that this was a novel disease and we needed to take part in world-beating trials to find a cure for COVID-19. To that effect, the Bradford Teaching Hospitals, the Bradford Institute for Health Research took part in two important landmark COVID-19 studies, the WHO ISARIC study, which was looking at the data of patients admitted to hospital with severe COVID-19 and identifying what their risk factors would be, as well as the largest COVID-19 platform trial in the world, the recovery trial, which was led from the University of Oxford. Bradford Teaching Hospitals was one of 170 organizations taking part in this trial across the country. We were the second highest recruiter into this trial with over 35% of our patients belonging to the BME community. Now that trial in early June 2020 found out that the steroid dexamethasone was life-saving in patients with COVID-19. It reduced the death by 25% in people who needed oxygen therapy and about 33% in people who were requiring some form of a support to their breathing. We were using an early therapy called CPAP, continuous positive airway pressure, to help these patients tide over the problems with their breathing in the early part of the COVID disease. Subsequently, we took part in various other arms within the recovery trial. One was convalescent plasma, so we were taking the blood of people who had recovered from COVID-19 and using the plasma to the patient. That subsequent treatment proved to be futile and was abandoned. We also took part in another drug called tocilizumab, which is an anti-inflammatory drug commonly used in inflammatory arthritis, and it showed it reduces the death when used early in patients with COVID-19, and that drug is now used very standardly across our wards. We also explored other drugs, the popular monoclonal antibody called Regeneron CoV-2, and that antibody is currently being used on our wards in patients with early COVID-19. The other big trial that we took part was coordinated from the University of Southampton, was the use of inhaled beta interferon called the Synergen study. We were only one of 5 sites across the country taking part in this trial, and this was used to treat patients with early COVID-19 before they slipped into the severe spectrum of the disease. So Bradford, by taking part in these platform trials, enabled our patients to receive these early interventions, and this helped save many lives across the city. So I'm very grateful to all these patients who took part in these trials. They played a very vital role in finding potential cures for this dreadful disease. So in July 2020, Bradford Teaching Hospitals and the Bradford Patient Recruitment Center was selected as one of what we call potential vaccine trial hubs, only one of 5 centers across the whole of Yorkshire and Humber, to take part in potential vaccine trials. 15,000 participants was recruited in this trial, and Bradford played its role by recruiting 726 participants in early October 2020. We were the 3rd highest recruiter in the whole of the UK into this trial. Now this trial was investigating the efficacy of a COVID-19 vaccine. Patients received 2 doses of the vaccine 21 days apart in early October and in early November. The subjects who had not received the vaccine in the first vaccine phase in October-November 2021 would have received the vaccine in the blinded crossover, which ensured that every single participant in the Novavax trial by early May 2021 would have received 2 doses of a vaccine. When we were selected to do the Novavax trial, we did a lot of work across the city of Bradford. We went out to the community, we went out to the mosques, we went out to the various religious organizations to talk to these people to make sure that we had a wide representation. Now 7% of the actual recruits into the Novavax trial were from the Black, Asian, minority ethnic communities. We also included our various partners, as this was an Actus One trial that was carried out at the DHEZ building of the University of Bradford, which is continuing to be used to carry out the various visits of this trial. So this trial was a unique partnership between the Bradford Patient Recruitment Center, Bradford Teaching Hospitals, University of Bradford, and primary care across the city. The early results of efficacy were published in January 2021 and subsequently in June 2021, where it showed an efficacy of 89.3% against the conventional SARS-CoV-2, but a 95% efficacy against the Kent variant, with good efficacy rates against the the variant which was discovered first in South Africa. So this vaccine is very close to getting an approval to become another COVID-19 vaccine. I'm very proud to say that Bradford played a very important role in producing another vaccine to the entire population of the world. We had wide media coverage from both the national and the international media. So we had the likes of the BBC, the ITV network, as well as BBC World Service, who came and interviewed our first participant, one of our own consultant colleagues who belonged to the BMA community, who was the first recruit in Bradford into this trial. So it was sending a strong message to the community that these trials are safe, and it was important for the wider community in Bradford to take part in these trials. We also set up what is called as a Be Part of Research registry in Bradford, and we had over 7,000 people sign up to be part of the vaccine trials, even though we had only 726 places. So by March, April 2021, as the vaccine rollout within the NHS was going full speed, the government also had an idea that we may require a booster in the autumn and the winter to protect our population through the autumn and the winter surges of COVID-19. We were selected one of 15 centers across the country to be run the Co-Boost vaccine trial. The Co-Boost trial was looking to answer the question, people who have had 2 doses of an NHS vaccine, did they need an additional booster? So in this trial, we recruited 148 participants across the city of Bradford. Half of these people had had 2 doses of one of the COVID-19 vaccines, namely the Pfizer vaccine, and half of them have had 2 doses of the Oxford AstraZeneca vaccine. We started recruitment into this trial on the 1st of June 2021, and it's extremely proud to say that we recruited the world's first participant into a COVID-19 regulatory approved COVID-19 booster vaccine trial. And it was none other than our own Deputy Medical Director, Professor Alex Brown, who volunteered to take part in this trial. So the subjects were subject to a blood test at day 1 of the trial. They received the booster dose, and then they were brought back at 28 days to see whether they had antibodies which would neutralize the virus, but also working on the different strains of the COVID-19 virus. So we know that there are various variants. So this booster trial is also working to see whether the booster will protect us against the emerging strains of the COVID-19. We have found out that with the initial day 28 samples that we obtained in our participants, the addition of a booster provides that added protection, because there is some concern about the waning of the immunity, particularly after 6 months of receiving the second dose. This trial will advise the government, and the government is carrying out this booster vaccine campaign. It will help the vulnerable as well as our frail population in Bradford, protect them through the winter months along with the flu epidemic we may see, and protect lives and prevent them from being hospitalized. So it's a very, very important trial. It's going to safeguard our population in this city, in the whole country, and across the world in future as well. So the Novavax vaccine trial was a very successful trial in Bradford, third highest recruiter in the country. I have to thank every single participant who took part in this trial, as well as those who volunteered to take part. Without their support, this trial was not possible. But it's so proud to be part of a vaccine trial which has provided another vaccine to the world, because as we exit the pandemic, the only exit strategy we know is a vaccine which protects our population from catching this dreadful virus. And we think as we exit the pandemic, hopefully in 2022, Bradford would have played a very important role in finding cures for COVID-19, but also playing a vital part as an organization across the city and leading from the front in finding a vaccine for COVID-19. But I must thank the tremendous support that I've had from Bradford Teaching Hospitals, the University of Bradford, particularly our Chief Exec Mel Pickup, as well as Shelley Congdon, the Vice Chancellor of the University of Bradford, who stood by me to ensure that we delivered this trial as a city very successfully. So I would describe this as the pinnacle of my research career.